AM 1450, FM 99.3, KNSI. Welcome to another edition of Your Health, produced in conjunction and cooperation with the folks at CentraCare. Today, we are going to talk about telehealth and school telehealth, to be a little bit more specific. What is school telehealth? How can it be used to its utmost advantage? We have in studio with us guest expert Dr. John Dennis, who specializes in adolescent medicine and pediatrics. Here's a guy who wants to deal with teenagers, folks. Doctor, it's good to have you in studio.
Thank you, Bob. I appreciate being here.
When we say that word telehealth, what are we talking about?
Telehealth is really a tool. It's a term that we apply to video and audio connection between patients and providers, sometimes between providers. And it's something that can be time-delayed or real-time. And it can be like Skype or Facebook, sure. Or it can be something where you send in a message to your provider and they respond back.
Sure. Now, this has been around for a while.
Well, quite a while, right, since really 70s.
Right.
And the CentraCare health system has had a telehealth program for 6 years. So this involves a variety of programs, connection with behavioral health, psychiatry. CentraCare has one of the state's largest telestroke programs, which is really reaching all over the state, which is fantastically, really very effective. And also connection between different providers. Our radiology professionals have had connections for many, many years. So for many years, the radiology readings would come from Australia at night.
Really?
Yes.
Interesting. Now, if telehealth has been around for a while, how about the marriage between telehealth and what is happening at our schools? How long has that been around?
So telehealth with schools has been around for many years, too. And there's a story behind this. About 2 years ago, I was working in the clinic with one of our nurses who also works as a school nurse up in Little Falls. And I said, Amy, what have you been up to? And she said, oh, we just saw our 10th telehealth patient. And I said, what? In Little Falls?
Yeah.
So tell me the story. So they had a wonderful cooperation between the clinic there and the school. They had some opportunities, and so they had already started it. So that began the little look to start a program here. Telehealth in schools has been in existence for a number of years down in the South, in some of the rural areas. It was a federal initiative to connect some of the rural schools who didn't have access, Appalachia, further south. But it's also expanded now into many other areas. It's very popular in California and several other areas now of the country, and there's a very large national organization, several that do this. Okay,
now I can imagine with the advent of technology, it is becoming almost second nature, right? To have something like this telehealth system set up.
It's a tool.
Yeah.
And like any tool, it can be used well. It's like your cell phone. It can do marvelous things, or if you don't use it right, it can keep you up at night and disturb things. But if it's used well, it has a wonderful advantage to make care more convenient for patients, for parents, to help the school in particular. And this is probably one of, we think, the greatest opportunities is to help parents and schools and meld this technology to help make care better and more convenient.
We are going to get in very deeply here when it comes to telehealth, because I can imagine if folks, their imaginations are anything like mine is racing right now in the ways that this could be used in a good way, but also maybe sometimes in a not so good way. We'll get to that. Our guest in studio today, Dr. John Dennis. My friends, we are talking about telehealth. You are listening to Your Health on KNSI. AM 1450, FM 99.3, KNSI. Welcome back to Your Health. Today, we're talking with Dr. John Dennis, who is an adolescent medicine practitioner, also a pediatrician. Dr. Dennis, when it comes to adolescent medicine, do you find that telehealth is really, really an important tool in that toolkit?
It is, and in a variety of ways. So what we see is that increasingly in schools, our schools are dealing with an increasing amount of psychosocial stress.
Okay.
Anxiety, depression have become very commonly identified in the teenage population, and our schools are just overwhelmed with dealing with all these things. When we went to the school system here in District 742 in St. Cloud, we said, what are your needs? And they immediately all said mental health. There's a very, very innovative program that's been around for many different programs, actually, integrative health, helping with the school system here. St. Cloud and District 742 has been in the forefront of using mental health, but there is an increased need, and it's not decreasing, it's growing.
Sure. Can you give us some, for instances, how would the whole thing play out?
So the way this would work is that a student would go in and would see the nurse in the school or see the counselor. And if they feel that the student has a problem that they feel needs extra help, and in this case, if they're a patient at CentraCare,
right,
then they would make the contact to our walk-in clinic, which is the primary entry point right now for this. And we would arrange a visit as soon as possible.
I would imagine, again, with all of the physical buildings, school buildings here in District 742, my gosh, this is going to be a very well-used system.
It could be. So this is a pilot initially. It's opening in Apollo High School.
Okay.
There is intent to continue to expand it into the new Tech High School. And the school district has expressed interest in expanding it to the other schools.
So mental health will be the primary use of this telehealth system then?
This has been the initial request from the school district, that was their initial help. Okay. However, this also would involve acute visits that would lend themselves to this kind of modality.
Okay, what is an acute visit?
So this may be something like conjunctivitis, a cough, a rash, runny nose, eye irritation, allergies, things that are simple. It doesn't lend itself to more complicated things, but it can help for the school nurse to help provide extra information to triage or to get the patient where they need to go.
Now, the first thing that I thought of when I knew that we were going to be talking about telehealth is bone is sticking through the guy's forearm, and what should I do about this? Well, that is a compound fracture, something that very basic. But that's not the case.
No, this is not meant to be care for everything.
Okay.
It's just not the right tool for that. And the school nurses are very well adapted and equipped to handle emergencies. They do this all the time. This would not be an appropriate thing for a fracture.
Yeah.
But for a student who is having anxiety issues, school phobia, for some problems with adjustment to stresses, other issues that may come up, and the school counselor feels that the patient needs extra help with that, this may be an entirely appropriate thing.
Doc, when you're dealing with teenagers and adolescents and anxiety, have you seen an uptick in all of this in recent times?
It's a great question. We seem to be identifying a lot more, yes.
Do you have any idea why?
There are speculations. We can think that it may be due to the pace of life. It may be due to increased demands at school, at home, financial concerns. It's mostly speculation. I don't think we know for sure, but we're certainly identifying it more. Part of that might be we're just better at being sensitive and identifying it too.
Now, this is not telehealth. It's kind of like radio health, right? What we are doing right here. And I think I can demonstrate how useful it can be very simply. Can you address what parents could be doing to make life a little less busy for their kids from a healthcare perspective? What can we do right now, if we can give a little bit of advice on the radio, to make that family unit and make those kids just a little bit better, their health a little better?
Excellent. Well, I think you're getting into the area where we want to eventually be, which is prevention and identification early. So one of the things I tell and we go through with our families repeatedly is, how much sleep are you getting? It's a critical thing. Many years ago, what we used to attribute to the ups and downs of adolescents were really just they're sleep deprived. Mm-hmm. Some districts have even moved their start times later and found improved attendance, academic performance, decreased auto accidents, and in one case, decreased auto accident deaths just because of getting more sleep. So it's a critical thing. A second simple thing that may seem too simple, but is, do you have a meal together? Do you sit down together and talk together? For adolescent development, this is one of the primary areas where you connect with your child, they connect with you, you transmit all sorts of different values. So a simple thing that frequently gets missed in busy lives.
It sounds like Leave It to Beaver. It sounds like Norman Rockwell. It sounds like the way life used to be.
You could say that. And I think what happened is we threw the baby out with the bathwater.
Literally.
We got busier, and we missed the fact that you need this connection. And unfortunately, talking about technology, for some families, sitting down at the table means interrupted 3 or 4 times from cell phones. Right. So another simple thing to do is have the parents set a good example. No cell phones, no media, no TV, nothing with a screen while we are communicating.
When you talk with your moms and dads and patients about screen time, do you come up with what is a good amount of time for screen time and what is not a good amount of time for screen time?
There are some recommendations, and in general, limiting screen time to under 2 hours is very important. And that includes at school, because there's a lot of screen time at school, too.
Right.
But screen time is usually sedentary time. It's usually not getting activity, which causes other problems.
Mm-hmm. Obesity?
Obesity is a huge problem, and so this is a major thing.
Our guest is Dr. John Dennis. He specializes in adolescent medicine, pediatrics as well. Thank you for indulging me, doctor. We try to do just a little bit of telehealth here on the radio, right? It is, in fact, your health. And when we come back, we're going to talk about more examples of the benefits of telehealth, the good things that can really, really happen when we have the opportunity to see the doctor as we sit in the classroom. AM 1450, FM 99.3, KNSI. We'll be right back. AM 1450, FM 99.3, KNSI. Back with Dr. John Dennis, who specializes in adolescent medicine and pediatrics. We are talking today, folks, about telehealth. Dr. Dennis, I would imagine, as you said off the air, that there are some parents who are wondering, oh my gosh, this sounds wonderful. How do I make it work? How do I get involved with a telehealth medical program through CentraCare and District 742?
So the aim is to make the system work with the current school nursing personnel. So they would access this through the school nursing personnel. The school nurse would do the assessment and decide if the visit is appropriate, and then would make contact with us. However, we also are intending to have scheduled visits for appropriate things. This would be like follow-up for ADHD, medication, things that could be appropriately accomplished over a video connection, and would involve the parent also on the phone. So if this is appropriate, then those will eventually be scheduled in the future.
We initially started talking about mental health care with schools, and I can see exactly how this would work very well with students, just taking a 15-minute break from your day to check in with your healthcare professional.
Part of it is that we have a very innovative program in CentraCare, which is integrative behavioral health. Mm-hmm. So in our pediatric clinic, we have 2 counselors who are on duty at all times during the office hours. And Barb Skoji-Mack, and we have a new person now, Monica, who's now available. They will be available if we have identified an emotional problem they can immediately attend to it. So this affords us a much more immediate availability of counseling for crises and that sort of thing.
You use the word preventive, which is really good. A preemptive conversation can really save someone.
We're hoping so. For many people, when the crisis arises, they need to talk to someone.
Right.
And our school counseling staff is excellent. Our school nurses are excellent. They ask for more help, and so this is one way that we provide it.
Okay, let's again back up just a little bit. What conditions would be inappropriate and what will be appropriate for telehealth?
So visits that would obviously require procedures or intervention. I think you brought up a fractured arm, concussions, lacerations,
Sure.
fractures, trouble breathing. These obviously require intervention. That would not be appropriate. For acute visits, things like conjunctivitis, rashes, colds, allergies, cough, these are things that we can take care of. There are some interesting differences between just a television and or video and audio connection, because telehealth also involves use of other transducers. So we can have a stethoscope. I can listen to a heart.
Right.
I can listen to a chest. We have a camera that is a microscopic camera, so I can see the skin actually better than I can with my naked eye
Right.
through the camera. We can also look down the throat and look in ears also, all through the televideo connection.
Do you see down the road, do you see almost a small medical office at our local schools so that they could hook up to various monitors, that sort of thing?
There are a number of things that are possible down the road, and a variety of things that we can dream about and hope about in the future. So this initial program in Apollo is a pilot study. So we're working out the bugs, trying to see what works and what sort of things we can do. And we're going to learn quite a bit from this as we progress.
We're not quite to the stage where we just pass the mouse over the human body like we used to do in Star Trek and figure out what's going on there. Next year.
Yes.
Right?
Not today.
Not quite, exactly.
Not today. So this brings up an issue, though, that I think is important. And our providers are extremely very focused on it being quality. So there's nothing that any of our providers would allow to be less than an office visit.
Right.
So it's only where it's appropriate. Now, for many, many years, we've handled some medical care over the telephone. This involves an additional advantage of doing that. So right now, we do have telehealth in terms of delayed or asynchronous kind of connection. Mm-hmm. People send us photographs of rashes all the time.
All the time, right.
And it can work out fairly well. But this real-time connection has an advantage of improving the patient relationship and making it more convenient for families in some cases where it's appropriate. But our staff absolutely is committed to it only being high quality. There are, unfortunately, some other places where people are able to sign online and they get antibiotics when it's inappropriate.
Sure.
And there's not a relationship with a provider. There's not any continuity. We think this is not appropriate. It's not good quality care. And that's absolutely not what we're about.
Right. Doctor, there's one very important question I have stayed away from, and that would be the fees that would be involved for a telehealth visit.
So this is a visit that is covered under most state of Minnesota insurance plans and many insurance plans. The cost of the visit would be the equivalent to an office visit for the same amount of time.
All right.
So it's basically another way to conduct a visit.
A lot of questions still remain, I'm sure, from the parents' side of things. Doctor, how can they reach out to CentraCare, perhaps even to you, to get more information about school telehealth?
Or available for questions. They may call in and talk to the pediatric department, call in and talk to one of our our RNs who may do that. They are welcome if they have questions. They may send questions in to me also, that is fine. And I'm willing to take those. My email, I would send out, say, please send serious questions. That's Dennis J. at CentraCare.com.
At CentraCare.com. DENNIS, the letter J, Dennis J. at CentraCare.com. And again, serious questions only.
Please.
Dr. John Dennis, thank you so much for shedding light on something that I think will only be limited by our own imagination as to how we're going to be able to make this thing work for so many people.
There are many, many more things we can dream of. And there are many other possibilities. So even with all this access, there's just still going to be an increased need for therapy. And so conducting therapy for simple things through automated means is a possibility too.
Technology is a wonderful thing.
Yes.
Doctor, thank you.
Thank you.
You have been listening to Your Health. Our guest, Dr. John Dennis, adolescent medicine and pediatrician with CentraCare on AM 1450, FM 99.3, KNSI.